Hello and welcome to our video. Today we'll be talking about croup, also known as laryngotracheobronchitis, which is the upper airway disorder in children caused by influenza, parainfluenza, or other viruses. As mentioned before, it is common in infancy, and the techniques such as laryngobronchoscopy and immunofluorescence are used to identify the specific cause of croup. During croup, the upper airway is inflamed, causing the symptoms of a barking sort of cough, a stridor, which is a high-pitched noise in the cough, and a hoarse voice and respiratory distress. In rare cases, croup can result in severe obstruction of the airway and death. As you can see in the picture, the top picture with the black arrow pointing at it, that is the normal diameter of a trachea. You can see that the diameter is much bigger than the one which is underneath with the red arrow pointing at it. That is during croup. As you can see, the trachea swells up, making the airway much smaller, and that is why it is harder for the person to breathe. For croup, the worst outcome if left untreated is hospitalization due to the respiratory stress, and if symptoms arising from the inflammation of the upper respiratory tract are not revived, then death due to the obstruction of the airway is possible. The best outcome if left untreated, croup is an illness that will be recommended to be treated regardless of severity. For low to mild symptoms, they may dissipate without intervention, steroid intervention. But for severe croup, if not, it is not self-curable and does require intervention for symptoms not to persist. Airways will narrow, limiting gas exchange, which can lead to hypercapnia, which is the increase of carbon dioxide in the body, forming carbonic acid, which is very deadly to our body. And the child may fatigue and lose consciousness due to the lack of oxygen in their body, which can lead to death. The least expensive evidence-based approach to treating croup is glucocorticoids, which is beneficial to treating children diagnosed with croup. Regardless of severity, we highly recommend clinical approach which is required in the use of dexamethasone. A dose of 0.6 milligrams, which is consumed orally or intramuscularly, is very beneficial, and there's been research found that dexamethasone correlates to lower rates of adrenaline use and lower admission and readmission cases to the ER in hospitals. The positive effects are usually witnessed within 6 hours, and anti-inflammatory properties remain for at least 12 hours. The most expensive evidence-based approach to treating the topic is in severe croup. It is treated through intubulation and corticosteroids intervention. Such an intervention is only provided in circumstances in which an individual's trachea has swelled up, blocking normal respiratory function. The most expensive evidence-based approach is the administration of nebulized epinephrine, which is also known as adrenaline, which is administered through the mouth via inhalation of a mist. Then the doctor will then evaluate and further monitor the patient on their symptoms, etc. Epinephrine is safe and efficient but has undesirable symptoms, which includes increased heart rate and trepidation. The best suggested health professionals in the treatment of croup is with mild to moderate croup. Treatment can be managed with a general practitioner, but when it becomes severe, hospitalization is required, and the patient will be treated in a pediatric ward, which is when the nurse or the doctor will need to treat the croup in case the symptoms persist, and a doctor will need to diagnose the severity of the croup, and this is done by history questions and physical examination for best treatment. We highly recommend the use of dexamethasone, which has been treated and found to have improvement on those who participated in the administering of the drug. It is the cheapest, and we find it as the best suitable. Even though epinephrine has been found to be safe and effective, it has undesirable symptoms such as increased heart rate and trepidation. Like, the last thing you would want for a child is an increased heart rate due to croup. Thank you very much for listening to our video, and I hope you enjoyed.